So you had your knee injury at 17.
Mhm.
How much time was there between the injury and when you actually kind of graduated in holistic health?
Wow. Um, Probably 30 years.
Okay, so it's a big gap. Okay, so you had that original injury, you had the surgery.
Yeah.
How many years was it before the pain kind of really started showing up in your knee in a more kind of significant or persistent way?
Yeah, so it really started probably in my late 20s, and, being the stubborn person I am, after I sort of recovered, my doctor told me, "You'll never play a sport that really moves laterally ever again," so I took up tennis. Um, and
Which
so
is
I
70% lateral.
Right. So I took up tennis. I became a USTA men's tennis captain and ran a tennis team for a long time. And about probably late 20s, early 30s, I would notice that after I played a tennis match, it would hurt for a little while. Then getting into my 40s, I started having to have steroid injections in my knee. And that would last for, 6 months or so. Getting late 40s, I started to feel more of the bone on bone, and it got to a point where I was having to have a shot every 3 months. And then probably around 50, if I went out and played a tennis match, I couldn't sleep for 3 or 4 days
Wow.
because the pain was so bad.
Yeah.
And I continued to do that for a while, and would get shots, and then finally, I went skiing one time, and going down the hill, I could feel my knees just knocking together, and it was so painful that I couldn't go back up the hill and try it again. And so that's really whenever everything sort of around 50, 45, 50, that's when everything stopped. And my orthopedist, of course, wants me to get on the table and replace my knee. But I had an upper orthopedist on my tennis team, and he was a friend. And I scheduled an appointment with him and went to him, and he's like, "You've got a knee problem. I don't work on knees. What do you want?" So I just told him, "Well, I want to ask you a question as a doctor. If it was your knee, what would you do?" And he said, "Well, I wouldn't replace it. You're 49 or so at that time." He said, "If you replace it now, it's going to last about 15 years. You're going to have to replace it again. And, most likely if you're healthy, you're going to live for at least another 20 or so years, and you're going to have to replace it again. And the third time it does not go well. He said, one of these days you'll wake up and you'll know you have to replace it." But I chose to use mesenchymal stem cell injections in my knee instead. And I did that 2 years ago, and it's been fantastic ever since.
Yeah, interesting, interesting. So you mentioned you're getting steroid injections. What were some of the other things that you tried to relieve the pain, and how kind of effective were they?
Yeah, so I did the hyaluronic acid
Hmm.
injections. That didn't do anything for me. I've had conversations with people who had it, and it worked wonders for them, but it only lasts for so long, just like steroids do. Um, and then other than that, physical therapy, and they make these machines that you put ice in, and you wrap a device around your knee that it pumps that cold ice water through it. Um, that compression, but none of those things really did much. I mean, the
Mm,
steroid injections were the most effective at helping with the pain. And then the stem cells were fantastic. Have so far been fantastic.
mm,
Now, I may have to replace it one of these days, but my most likely I'll try to shoot for stem cells again
mm.
if it comes to that.
If this sparks something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify, or listen on Apple Podcasts. Like, subscribe, and stay connected for more.